Newport News is about 49% African American. What we noticed is that there were disparities, as you, Ben, and Bernard were speaking earlier about who's getting certain types of care. We were looking at the like what's causing this, and in many instances it was footwear. On the backside, once these people get their ulcers and we found that a lot of doctors, instead of being patient to work through these patients, were just going right to the amputation. In Hampton Roads, I'm known for two things: the bomb and saving people's lives in terms of the limbs. About 20 years ago, Calvin and I, my partner, were in our office seeing patients about 11:30. One of my assistants comes in, says you have a call from a patient that's at the VA hospital. And one of my patients called me from a gurney. He was outside the operating room. They had everybody lined up. He just happened to be like maybe number 8 in line, but he was going to get his leg amputated. I asked him if he could put his surgeon on the phone with me. What we did then, we couldn't probably do now, and that is I switched places with that surgeon and took his patient into the operating room, like
Mhm.
without any paperwork being done. This diabetic patient got drained the wound of the pus, treated him with antibiotics, debridement, grafting.
But which interspace or which area was it?
Sure. So this particular gentleman, basically diabetic, not well controlled, but at the same time, he had a wound that expanded from the middle of the foot plantarly, coming up the up around the medial malleolus, just above the ankle.
Goes tracking up the like the interosseous lumbricals up the flexors.
That's correct. So took him into the operating room, opened this area up even above the area of the wound, like 100 cc's of pus pouring out of this guy's foot. But this is the clincher. We got him healed probably in about maybe 4 or 5 months. And guess what he did once he was healed? We didn't know this, that he was a car dealership. He said, "What kind of cars do you want?" And at the time, we were into pickup trucks. This is Hampton Road.
Right.
Gentleman delivers two brand new Dodge Black Ram, Dodge pickup truck to
Wow.
our
Holy
office.
smokes.
Wow.
You changed his life, but you lose that first leg, and then you've got an increased chance of potentially losing that second leg, even if you have the prosthesis. And then comorbidity mortality rate probably doubles it, maybe even more. Hey, we've got GLP-1s now. So I think we should all be very astute at not quoting statistics from 2016. We got to be relevant to today, what's happening with the sugar control. These rates are going to go up for sure.
Absolutely. And to your point, Ben, not to mention too many stats, but usually once they receive that first BKA, within 5 years, they're probably getting another. And now we've got all this pressure on the heart. These people are having silent heart attacks and dying.